bronchioles who evolutionarily are adapted for running and hunting and things like that, so we can have more lobes. So anyway, so that's just the, see the apex and the base and the names of the lobes. So anyway, if I were you, I would probably look at a lung and familiarize myself with the lobes. Also, the left lung has a cardiac notch, because remember the heart sits in kind of an angle. So I guess if the heart sat right in the middle, like many people think it does, you guys know it doesn't, then we have room for an extra one, so we have 3 on each side, but that ain't the way it works. 3 and 2. Now, the tree works like this. So, you know the primaries, you know the secondaries, one for each lobe, and then tertiaries. And then tertiaries get smaller and become terminal bronchioles. Become smaller and become respiratory bronchioles, which then lead into the exchange zone of the lungs, which lead into the alveolar ducts and the alveolar sacs, which is where the actual gas exchange takes place. Now, let me think now, I don't do any lung histology. I should probably show it to you just so you can get an idea of what lung tissue looks like. It looks kind of, I don't know, you look at it and go, wow, it's so just fragile looking. All the little sacs are very fragile, and because that's where gas exchange takes place. It's a membrane, you know, that gas exchange takes place in. So in these sacs, of which you have millions and millions and millions in your lungs, this is where the CO2-O2 exchange takes place across something you'll see in just a minute called a respiratory membrane, which is kind of important for you to know. So that's the tree. So it goes primaries, secondaries, tertiaries, terminals, respiratory bronchioles, finally into the ducts, and then deepest into the lungs, into the alveolar sacs, where gas exchange takes place. So this is what it looks like. Here's primaries, here's the secondaries, here's the tertiaries. Now we're going down here, we're getting in, here's the tertiaries. Now we're getting down in here into the terminal bronchioles, the respiratory bronchioles, and then these little things that look like clusters of grapes on the ends of little little stems almost. These are the very tiny little branches which lead into the gas exchange sacs called the respiratory bronchioles. So all of this, until we get way down here into this area of the lung, is just the conducting portion. That's just getting air into a place where exchange can take place. Because in here, no exchange takes place. This is just the plumbing. One thing to look at on here that's sort of important to remember is these are hyaline cartilage rings. But as you come down deeper into the lungs, the cartilage rings become little plates. And there's smooth muscle in here as well, and that's a problem with asthma and stuff like that. But as we get even deeper in here, when we get way down in here into these terminal bronchioles, the cartilage disappears, and we just have a little smooth muscle channel that the air is passing through. So you can actually look at a slide of this stuff, and if you know what hyaline cartilage looks like, you can figure out which kind of, in a general sense, which sort of passageway you're looking at. And I will show you a slide of the lung which shows you what these little passageways look like. There's other ways to look at it with the type of respiratory epithelium present. We're not going to do that. So that's a picture of the passageway. And when we get down into this area, which looks exactly like that model on the back counter, which I don't use, this is where the gas exchange takes place. All these little sacs are covered with capillary beds, bringing oxygen from the pulmonary side into the lungs where the gas exchange takes place, and we can go back, to the heart with our fresh blood. So it's down here in this part of the lung where this stuff takes place. There's a commercial I see on television quite frequently for a medication called Advair. It's an inhaler for people suffering from chronic obstructive pulmonary disease, COPD. And the reason for COPD is the little exchange sacs, for whatever reasons, get destroyed. And instead of the lungs having millions and millions and millions of tiny little exchange sacs, it's sort of one large sac. You're thinking to yourself, well, who cares? One large sac versus millions and millions and millions of small sacs. It has to do with surface area. The more surface area you have, the more exchange can take place. So these commercials for Advil are helping people that have lung issues breathe a little better. They're also quick to point out that COPD is not reversible. It's not a cure. All it does is help these folks breathe. And sometimes you'll see older people, but not always older people, because young people can suffer from, some lung ailments, but sometimes you'll see older people, wheeling around the little, cylinders, or maybe sometimes they're even more portable enough that they can actually kind of wear them as a backpack, and they got the little, nasal cannula coming in. The reason for that is their gas exchange has been impaired to a point where the 20% oxygen that we normally breathe in the air is just not enough for them because they're not exchanging that well, so they need an extra sort of boost of oxygen, so to speak, to make the exchange possible so they can actually kind of walk around and become mobile. So this is where the gas exchange takes place, down deep in the lungs. Let me skip this one for a second and go to this one. The respiratory